Is keto bad for your heart? And I'm not going to promise to give you a definitive answer, but I'm going to give you my take on it. So to really kind of define what we're talking about, I want to talk about what is heart disease, because we all know it's very important. Heart disease kills 1 out of 4 people in the United States. About 250,000 people every year in the United States has a heart attack. And this is the leading cause of death in men and women in almost all ethnic groups. And when it's not, it's just behind cancer. So it's a pretty important topic, not to mention it costs our society $200 billion a year. So heart disease can mean a lot of different things, but what I'm going to refer to is specifically coronary heart disease. So this is the process by which the arteries that carry blood to our heart build up what we refer to as plaque, which can cause narrowing of the arteries, and ultimately, when it becomes unstable, can lead to blood clots forming inside these tiny vessels. I mean, these things are at best 4 millimeters in diameter, and so as you can imagine, if a blood clot forms there, you're in bad shape, and that's what causes a heart attack. So the question then becomes, what is plaque and why does it get there? Because if we want to know about whether we're harming ourselves, we need to be able to answer that question. So plaque is a substance that builds up within the walls of the vessel, and it's made up of a number of things. So partly it's made up of cholesterol. And a very simplistic way of thinking about it is if you have high cholesterol, it will build up in the arteries and that forms the plaque, and that's what causes the problem. But over the years, for decades now, our understanding of plaque, or sometimes this is referred to as atherosclerosis, has become a lot more nuanced. And we know that there's a lot that goes into this. In fact, cholesterol is not the only thing there. So there's cells from the immune system. There's expansion of smooth muscle cells and fibrous scar tissue in the plaque. And this happens for multiple reasons. So cholesterol likely does play a role. But there's also a process of inflammation where the immune system is overactivated or chronically activated. There's something called oxidative stress where oxygen causes damage to molecules, which then damages the arteries. There's excessive blood sugar, which then the sugar can attach to proteins and fats in the system and cause problems that way. There's calcium deposition. The same mineral that's found in bone ends up depositing in the plaque. So it's a very complex process. Some of it's just related to the way the blood flows. So the key then is to determine how are these things leading to risk so that we can then figure out how do you prevent this process and answer the question is if keto is going to harm it. The way that heart disease risk is looked at is there's a number of so-called traditional risk factors. So some of these things we can't do anything about. So aging is a risk factor. When you figure out that one, let me know about it. Genetics, we can't change. You have what you're born with, and heart disease does run in families. And it's not usually just one gene. It's usually kind of the sum total of everything that you come into the world with. Other factors you're probably very familiar with, things like smoking, lack of physical activity, elevated blood sugar, and abnormalities in cholesterol, in particular elevated LDL cholesterol, low HDL cholesterol. I'm going to talk more about this in a little bit. High triglycerides, high blood pressure is a risk factor, and then there are the other risk factors that are not necessarily considered the traditional risk factors, but things like excessive inflammation. If you look at these different factors, so some of them we can't change, some of them we can address by lifestyle changes or medications, and then some of them stand out in particular over the past 30 or 40 years because they've been getting worse. And specifically, these are the epidemics of obesity and weight gain. Did I mention obesity as a risk factor? And also diabetes. So presumably, if we're going to favorably impact or unfavorably impact heart disease, one way to look at it would be to say, how does anything we do affect these so-called risk factors? Now, notice one of the things I didn't mention as a risk factor was diet or fat in the diet. So the conception of how diet plays into it and the risk diet plays is that fat is the harmful factor. This is the so-called diet heart hypothesis. And so the idea is that if you eat fat in your diet, it's going to collect in your bloodstream and it's going to then raise your cholesterol or just remain in its own form as fat in the blood vessels. And then it's going to get in the walls of the blood vessels and that makes plaque. Very simple, right? It's just like if you poured fat down your drain, it's going to clog the drain. Same thing happens in the arteries. So this idea came about over 50 years ago. And as it turns out, it's just not true. It doesn't happen this way. And that's been shown through a number of different studies and more recently in what are called meta-analyses, where scientists or researchers will take a number of different studies and combine them together using statistics to try to see if there's a signal to show harm or benefit. And so when a lot of this data supposedly showing that fat's harmful comes from observational studies where they just follow a big group of people for years and years and years and to see, and you know that a certain number of people are going to have heart attacks or strokes or die. And so then you look to see, okay, well, what could predict that if we knew ahead of time? And when they've gone back and analyzed these studies and put them together, they found that one of the things that doesn't predict heart disease or death is saturated fat. What's stronger than observational studies are randomized controlled trials. So here, what we'd like to be able to do is say, let's take a group of people and we'll do an intervention for half of them and not for the other half, or two different interventions, and then compare, because then you know that the only thing that was different between the people in the group is what you changed. And in fact, this has been done in a number of different trials, looking at lowering people's fat intake or sometimes replacing the saturated fat with a different type of fat called polyunsaturated fat. This is a fat that's in nuts and vegetable oil, so different from animal fats. And then let's look in the randomized trial to see who has more events or not. Now, there have been quite a few of these done. When you look, though, at the very largest of these trials, so this is one of the largest diet studies are very hard to do because it's hard to change one thing. You have to follow people for many, many years. It's tremendously expensive. But there was a study called the Women's Health Initiative that was done in the 90s where they took 49,000 women and they took a certain proportion of them and put them on a low-fat diet, and the rest of them they just gave the dietary guidelines. Not ideal, I know, but that was the control group. They gave the dietary guidelines, just said, try to do this. In the group of women on the low-fat diet, they did successfully reduce the fat in their diet that they were eating. They reduced the saturated fat to less than 10% as recommended. And when that study was done, what they found was that there was no difference in death, in heart disease, in cancer rates. It didn't make a bit of difference. And now the researchers tried to spin it to say, well, this means, all of you low-carb people thought that low-fat diets would be horrible, and look, we did a low-fat diet and it didn't hurt anybody. That's called changing the goal, moving the goalposts, right? And more recently, there have been some other meta-analyses that have looked at some of these trials, because some people would say, well, it's not just lowering the fat, because people lower fat and replace with carbs, and we know that's bad. But if you replace the fat with these polyunsaturated fats, healthier fats, then good things will happen. But even in these trials, when they're analyzed and we only include the ones that were actually performed with good research methodology, no signal for fat causing heart disease. So this idea that fat in the diet causes high cholesterol, it's out the window. It's just not true. It doesn't mean diet's not important, as I think we all know, but fat's not the problem. So the question then is, in light of all these risk factors, what role does keto have? So how does keto affect these risk factors? So in answering this question, I think it's helpful to have a conception of this idea called the metabolic syndrome. How many of y'all have heard that term before? Yeah. So anytime we use the word syndrome in medicine, it means that we've made an observation. There's some things, some symptoms, some clinical conditions, some things that... Thank you. Yeah. Right. So that's just proof that I don't do this alone, and nor could I. Okay, so when we use the term syndrome in medicine, it means there's something going on here. We don't really know what. And the implication is that there's some kind of unifying feature. So a lot of these risk factors, high blood pressure, high triglycerides, low HDL cholesterol, elevations in blood sugar, fat deposition in the liver, and in fact weight gain, particularly belly fat, the visceral fat are in the middle, these things cluster together. These are separate things. You know, what does high blood pressure have to do with fat in the liver? And yet they cluster together. And so there must be something underlying all of this. A lot of people would say it's the weight gain, it's the fat, but plenty of people have this problem and they're not overweight. And so that doesn't really make a whole lot of sense that the fat's the cause. So when we look back at what unifies these things, it's a hormone, and that hormone is insulin. And then ultimately, there's something called insulin resistance that Dr. Westman spoke about, where then the liver and the muscles and other parts of the body stop responding as well. But the root issue here is excessive levels of insulin. Well then, okay, what causes the insulin? And that's carbohydrate. So it stands to reason that if you wanted to favorably impact these risk factors causing heart disease, you would want an intervention that lowers insulin, and ultimately to lower the insulin, you're probably going to lower the carbohydrate. So wait a second, seems like keto ought to be good for the heart. And so let's ask the question of how does keto affect these risk factors? Is this true? Well, it's certainly true that keto lowers carbohydrate and insulin, because first we need to make sure that this is a true statement. And in fact, when this is studied, this is just a graph, and you could see the red line are patients. This is from a small study where the patients were divided into 3 groups. Half of them were given a very low carb diet, that's the red line, and then the other half were either given a very low fat diet or a high unsaturated fat diet. And so this is a graph from where they gave them what they called a meal tolerance test, and they gave them an appropriate meal from the type of diet they were eating, and they followed what was the sugar and what was the insulin doing. And you can see, you don't even need to see the bars of statistical significance here to see that there's a marked difference with the very low carb diet. So nothing lowers carbohydrate in the blood and insulin like a keto or low carb diet. And in fact, when we look at the risk factor of obesity, consistently, almost without fail, low-carb diets have been shown to be superior to low-fat diets for weight loss. So this is a graphic from the Public Health Collaboration. This is the same website, and I put the website I got it from on the bottom. It's the same one that Dr. Westman mentioned, and actually I have to correct him because now it's 62 studies, not 47. So these studies keep on coming out, and it's never a different result. You might wonder why people keep doing them, because there's always either a statistical improvement on low carb, or even if it's not statistical, still numerically low carb does better. There are only 2 where it's equal. You could see there's 7 where low fat did better, but those weren't statistically significant. So this, this is what we call I'm victory.
5 years you need to do those studies so that graduate students will have one.
Right. Well, this, I think, I'm not sure how often they update this. This is at least from 2016 and maybe more recent. So here's some graphs from looking at a couple of different studies and looking at a number of these risk factors. And what you could see, so the one on the left side of the screen is from a study that was published way back in 2003. So definitely the grad students aren't looking at that one. And here they looked at a number of different diets. And what you could see on the bars is that for weight, for insulin levels, for TAG is triglycerides, HDL cholesterol, and then diastolic blood pressure, you could see that the low carb group, which is the light blue and the dark blue, is just 6 and 12 months. Number one, it's favorably impacting the risk factors. So forget about low fat, but low carb's doing good things. But it's also better than low fat for what it's worth. And then on the right side, we're just seeing kind of more of the same. This is a summary from 2 different studies, where one of which was one of Dr. Westman's studies. And you could see that in the first study, that's the orange and the blue bars, this was a cereal diet, high grain, versus a low glycemic index, which is lower carb, but not very low carb. And then that's compared to the low glycemic index in the purple, and then the fuchsia is the low carb group. And you can see that, number one, that the low carb favorably impacts almost all the risk factors: weight, A1C, which is a measure of blood sugar, glucose, which is blood sugar, the total cholesterol, the HDL, and the triglycerides. So low carb is clearly effective for favorably impacting these risk factors that we've already identified as being causative of heart disease. We'll get to the LDL in a moment. One thing that people might say is like, oh, sure, the low carb helps these things, but it's because people are losing weight. But this isn't completely true. That's probably part of it. But this is an example, one of many, where the low-carb diet was compared to a calorically restricted low-fat diet with a drug called orlistat that prevents fat absorption. And people lost weight essentially to an equivalent degree in both groups. So here you help the low-fat diet out by lowering the calories and giving them a medication, and they can have equal weight loss to low-carb. But the effects on blood pressure were different. So the patients in the low-carb group, that's the blue line, you could see at 48 weeks the blood pressure went down. On the other hand, on the other group, where they also lost weight, the blood pressure didn't get better, and it may have started to for the diastolic in the picture on the right, but it started going back up again. So this isn't just weight loss that's causing the benefit. This is a graph of a study done on fatty liver disease, and here's this is sort of similar to the one I just showed you, where there wasn't a real difference in weight loss because they set up the study because it's not a weight loss study. And on the right-hand side, you could see that on both a high-carb and low-carb diet, there is a reduction in IHTG. That's fat in the liver. So the fat in the liver goes down if you lose weight, but in 48 hours, it's gone down much, much more with the low carb. So low carb improves fatty liver and potentially does it quicker and more effectively than low fat. How about inflammation? So there again, there are multiple studies. This is just one example of a study done with low carb versus I think this was indeed a low fat, high carb diet. And CRP it's a test we could do in the blood. So when people have chronic inflammation, really any inflammation, the CRP level will be elevated. And so a marker of how inflamed your body is you do this blood test. And in the low carb group, the CRP was reduced significantly, versus the low fat group, it didn't change a whole lot. And so I think the comparisons to low fat are important and useful, and I think impressive. But even more important than that, I think, is the idea that if we just want to say, how does keto affect our risk factors, consistently, it's favorable. So, and lastly, blood sugar. It probably goes without saying that blood sugar improves better on a very low-carb diet, and the A1C reduction here at 24 weeks in this particular study was nearly 2%. So let's talk about cholesterol, because that's kind of it's the one thing that scares everybody. So with this slide, this is a bit busy, but what it shows is we're looking in each of the 4 graphs a different aspect of the cholesterol panel, or in the case of the upper left, this is the total cholesterol. And the authors of this study, what they did is they reviewed a number of studies, and each dot on the graph is one of these studies. And they said, let's look at all these different diet studies that compared low carb and low fat and see how did the particular aspect of cholesterol change. Did it go up, which would be above the line, or down, which was below the line? And then you could kind of just look at the graphs and get a general gestalt of what's happening. And what they found is that the total cholesterol, for the most part, except for one outlier study, didn't change a whole lot. The HDL cholesterol, so this is the so-called good cholesterol, you want it to go up. It did. It went up probably by, on average, around 10 or 20%. That's in the bottom left there. And for what it's worth, when the total cholesterol went up in study number, do you see number 22? So the HDL went up a lot in that study, so that probably explains why the total cholesterol went up in part. And then the triglycerides on the upper right, they went down a lot. So triglycerides on low carb typically went down about 30%. And so then that leaves us with LDL. So if you look at LDL, and generally speaking, it looks like there's not a whole lot going on there. So if somebody has concerns that if you go on a keto diet, your LDL is going to go up, well, you could tell them that the data shows that it probably won't go up, or if it does, probably not a whole lot. That's the broad general answer to the question. It's probably a slight increase. But this is basically what you could expect on average for cholesterol to do. So a lot of favorable changes and nothing that's obviously harmful there. But let's talk in a little more detail about the LDL. So LDL is reported, when you get your cholesterol panel, it's a concentration. It's milligrams of cholesterol per deciliter of blood. The concentration doesn't tell you how it consists when it's in the blood. So LDL stands for low density lipoprotein. That refers to a particle carrying the cholesterol. You know, it's like a ship in the ocean carrying cargo. And so these particles can be small or large. They could be numerous or few. And the concentration of the cholesterol doesn't tell you whether that's going to be the case or not in terms of the number or size of the particles. And so you could see from this simplistic diagram on my slide, you could have the same amount of cholesterol and have it be a whole lot of small little particles, or you could have the same amount of cholesterol and have just a small number of really big particles. People refer to this as small dense versus large and buoyant. And they've described these different patterns, because you can basically categorize people to sort of one pattern or the other, as pattern B, having lots of small dense particles, versus pattern A, where you have a smaller number of large particles. Same amount of cholesterol, but it's packaged completely different. And so even if the LDL concentration is not changing on keto, maybe this is changing. And in fact, that's exactly what we see. So what this slide demonstrates is a summary of a series of studies that were done with varying levels of carbohydrate versus fat in the diet. And what you'll see is that if you go towards the left, the fat percent is going down and the carb percent is going up. And what do you see in terms of the percent of patients who have pattern B? It's going up. And so what that says, if you have more carbohydrate in your diet, you're more likely to have that pattern B, that's small, the lots of little particles, versus going to the right, as our fat percentage goes up and our carbohydrate percentage goes down, the percent with pattern B is going down. Well, what's that mean? That means more of those patients have pattern A, so they're more likely to have the large particles. Why is that important? So it's important because if you look at the risk for atherosclerosis, for plaque buildup from LDL cholesterol, when there's lots of little particles, the risk is high. When there's a small number of large particles, the risk is low. And so in fact, even though the LDL is not changing on keto, we are seeing favorable changes to even the bad cholesterol. So lastly, looking at the way these risk factors are impacted, I'm going to show you a slide from a more recent study. So this was not a randomized study, but what it was a controlled trial where patients with diabetes were put on a very low-carb diet, ketogenic diet. Ketone levels were measured, so they knew the patients were following the diet. There's a problem with a lot of these studies is you don't really know the patients are doing it. So they knew these patients were doing it, and somewhere around 85% of the patients at the end of the year were still on the diet. And they measured all of these risk factors, and they didn't just measure cholesterol. This group measured the particles and the small particles. And what you can see is that not only are all of those risk factors that we just went through decreasing, getting better, but if you point out, let me see if you can see my mouse pointer there. So yeah, so if we look at the small LDL particles, they're going down a lot, by about 20%. And if we look at the total LDL particle, I'm going to have to look again and see where that is. I think it's here. The total particle count on average went down. And so even though the LDL cholesterol right here went up, the aspects of the LDL cholesterol that are harmful improved. What I'll also point out is So you go back here. Look down at the bottom. Look at these patients' medications. So they were able to take patients off of medications because of these improvements, because we don't want to hurt people. If somebody's blood pressure is going down, I don't want to give them the same amount of blood pressure medication. If the diabetes is getting better and I keep them on their diabetic medications, it's harming them. So the science at this stage in the game in 2018 is very clear. All of the risk factors that we know about, including LDL cholesterol on keto, improve. But there's this question, regardless of all of this evidence, and partly it's because people don't know it, but there's this question that you get asked: is there evidence that a ketogenic diet is safe? So, okay, that's, I guess, a reasonable thing to ask, although I think it's not completely fair, because really the question in my mind is there evidence that a ketogenic diet is harmful? And so it's semantic, but it's a little bit of a different question. The burden of the proof should be on somebody who wants to say what you're doing is bad for you, particularly when all of the risk factors are getting better. If they can't show you why it's harmful, then we should be able to ignore them. They shouldn't have to, we shouldn't have to prove that it's safe. So the answer to the question is, there really isn't any evidence that these diets are harmful. Now, I'm going to get to some of the observational data in a few moments, and I'll tell you straight off the bat that if you want to talk to me about rats and mice and what they eat, I don't care. That's fine, and I'm a clinician, and once you translate that research into what actually happens in people, then I'm all ears. But what a mouse eats does not have relevance to the patients in my office. So, but there are a few things we can look at that are suggestive that a ketogenic diet is not harmful beyond looking at risk factors. Now, that's a little disingenuous because this first graph that I'm showing you, we're looking at risk factors. But what I like about this particular study that was published a few years ago is that they did a meta-analysis. They took a number of different studies of low fat versus low carb, and they looked at the risk factors, and they amalgamated things in a way to say, okay, on balance, is this person better off or not? Now, we do this all the time in medicine, and we use what are called risk calculators, because let's say you quit smoking, but then you start eating bad foods and your cholesterol gets worse. Are you better off or worse off? It can be hard to say, but what we can do is we can take observational studies that have been done, punch your particular numbers into a calculator. There's a number of different ones online. And then we can determine what's your risk of having a cardiovascular event in the next 10 years based on what has been observed in other populations. And what this group did is they ran these calculations from the data in the studies that they looked at, and then they said, what's the chance that your risk would be better or worse on low carb versus low fat? Now, in this graph, one thing to point out is change in predicted risk. So first of all, this is reduction, and 0 means there's no change, up to 1.5, which is a 1.5% reduction in risk over 10 years. And so they didn't show anything on the other side because, frankly, there's hardly any data points there, because when people adopt low-carb diets, or not adopt, when they're assigned to it in a study, and you look at the risk factors and you run the calculation, if you look all the way over here just next to 0, so let's say what's the chance that there's at least the most minuscule reduction in the patient's risk on a calculator if they follow low carb, there's a 98.5% chance that your risk will be better on low carb based on the risk calculators that all your doctors and cardiologists are using. And in fact, particularly for people who are at higher risk to begin with, so these are divided by ethnicity, but these two lines are the higher risk groups, the chance on low carb for high risk whites that you get at least a 0.5% reduction is a 50%, that's already a 50% chance that you'll get a 0.5% reduction or more, and that's even higher for the African Americans. Now, what about some actual markers of or I should say measurements of the vascular system? So one way to measure how the vascular system's working is to look at something called flow-mediated dilation. So basically, we're going to block off blood flow, and then we're going to let up the cuff, and what should happen is you should see an increase in blood flow if the arteries are working properly. And in this study, what was looked at was a comparison on low carb versus low fat to say, is there a change in the flow-mediated dilation? If keto was bad, this should get worse. Our blood vessels shouldn't work as well. But what they found is, on average, there wasn't a significant change at 8 weeks. Another group looked at plaque in the carotid arteries and thickness of plaque or even just thickness of the vessel wall in the carotid arteries. These are the arteries that carry blood to our brain. What they found was that comparing a low-fat diet to low carb, that there wasn't any significant difference. So a low-carb ketogenic diet did not make plaque thickness worse. And in fact, anybody who lost weight, if the blood pressure went down, it got better. And the one most predictive feature in this particular study was how well the blood pressure improved for reducing carotid artery thickness, which, based on the previous data, we know that more likely your blood pressure is going to improve on low carb. So even, notwithstanding, I think we're better off with low carb. So I'm going to skip ahead a little bit just so we don't go too long on time. But suffice it to say, there's not a lot of information. And the stuff that I'm showing you are small studies, short time frame. And I'm showing you that because there isn't much else out there. There's no big long-term studies looking at actual heart disease rates or death in people who follow one diet versus another, a randomized study, because they're hugely expensive and they really just haven't been done and probably never will be, if you want to know my opinion, because I don't think it's really possible. So then what about this question? Because you're going to get this one over and over again, or you're going to ask me. So what about that study that just came out? Because I just told you there's no studies, and yet we seem to hear about one every 6 weeks in the media. So this is the latest. So did you guys hear that if you eat a low-carb diet that you're going to die 3 years earlier? Yeah. So here's the thing. Almost all of these studies are observational studies. These are not actual trials. And in fact, the observational studies usually aren't even truly studying low carb versus something else. They're just studying whatever. And they're measuring things and then finding, what comes out in the wash for the most part. And they probably would say that's not a fair way to describe how they do these studies, but overall in practice, it sure seems that way. So this particular study, and I'm going to give you some points that were made by Nina Teicholz, who's an author and journalist who writes a lot about this. So this was from an editorial she wrote in the Wall Street Journal. So problems. It was based on food questionnaires. The amount of calories they ate in the study were lower so low they didn't make sense. They said half the people in the study were eating less than 1,500 calories or so a day. They only asked what people ate 2 times and then didn't for 15 years in following the patients. And they didn't include anybody who developed heart disease or diabetes before the second time they asked them. They threw those people out. Any observational study where you're not randomizing, there's all kinds of what are called confounding variables, things that are interrelated that don't get measured that they try to control for. So I'll give you a particular example in this study. The best I can tell in reading their statistical method section, they didn't control for how much sugar people were eating. That's kind of idiotic, right? And then the fact of the matter is, at the end result, they can't explain it in a way that makes sense. So if you supposedly are showing that low carb kills people, you have to explain how. And one of their explanations, for instance, was inflammatory stress. But low carb diets and keto diets reduce markers of inflammation. So how does this make sense when all of those other markers are getting better? And whenever you hear these studies in the media, you never hear anybody really explaining how this happens. And that's got to get your antenna for something suspicious going up. And so I'll just give you a few pointers on why my recommendation is to try to really tune this stuff out. So this is data from the National Health and Nutrition Survey that the government does. And they use what are called food frequency questionnaires. And almost all these studies use some kind of memory-based tool for determining what people ate. And the percentage on the left is the percentage of reports that if the patient was telling the truth or I should say if they were remembering accurately, because I'm not saying they're not telling the truth, but people can't remember what they ate. I mean, try to remember what you ate 2 weeks ago. It's hard, and it's colored by a lot of other things. So if these people actually were eating what they reported they eat, then over 2/3 of them couldn't be alive. It's not compatible with basic metabolic rates in life. It's craziness. And so any study that's based on this particular tool, which is flawed, you've heard the term garbage in, garbage out. You've heard that saying. Well, there you go. I mean, how can you make conclusions off of bad data in the first place? And there's all these different things. I don't know if I should have used a different slide there, but you could think of any number of things that might be connected to what you eat. And let me give you an example of how this potentially works. So, if you imagine that somebody's really focused on health, and they've been listening to these dietary guidelines, and so they're eating what we would consider probably not the best diet. Well, they're probably, if they're that focused though on health and following rules, they're probably focusing on a lot of other things, like they don't smoke, they exercise, they're probably, making sure they're getting good sleep. There's a lot of other things that they do. Whereas somebody who has been living, hasn't been living under a rock, and has been completely ignoring the flawed advice that's out there, well, the reason they're ignoring it is probably not because they're a low-carb proponent. It's probably because they just don't care that much. And they're probably not doing all the other other health-related behaviors that they ought to be doing. And you can't control for all of these things. And so what you get is, they call it like the healthy user effect. And so the people who do better, well, you find out that they were eating a low-fat diet, but maybe that's just because they were doing all these other things. So, and when it comes down to it, you can relate just about any food. And this is a really interesting one, and I'll probably end on this and then save the other stuff for questions. But so this graph is from a study that was done by a researcher in Stanford who focuses a lot on these methodologic issues with studies. And what they did is they took a cookbook that's been in print for a long, long time, and they randomly selected ingredients. And they picked out randomly 50 ingredients from the cookbook, things including pepper, flour, common stuff. And then they went into the medical literature and they said, how many of these things have been associated with some sort of health outcome, good or bad? And specifically, they're looking at different cancers. And they found that I'm probably going to give you I'm probably going to get this slightly wrong, but I think it was 47 out of 50 ingredients were associated with something. And what the graph shows is, for most of those ingredients, so they're listed, that's on the bottom part here, you could see dots on both sides of the line. So they were found to be both helpful and harmful, depending on the study. And this just goes to show how fraught this type of data is when you try to prove anything. So my conclusion is that low carbohydrate diets are safe and sustainable. This bottom picture comes from Diet Doctor, from Dr. Einfeld's site, and I love it because how could you argue with that? This is just real food. This stuff people have been eating for hundreds of thousands of years. And Mary Lou, I forgot to give you this pyramid. But so this is the Keto Pyramid. And again, does anything on there look particularly unhealthy? There is no such thing as an essential carbohydrate. So on the left here is something, I believe the left is kwashiorkor, which is a protein deficiency, because there are essential amino acids in proteins. On the right is marasmus. This is due to missing essential fats and just general malnutrition. And let me show you, now I'm going to show you a picture of a carbohydrate deficiency. Are you ready? Yeah. There you go.
Wow.
So these are Inuit people, and they consist on a diet that is composed of very little carbohydrate. And I think the picture speaks for itself. There's plenty of vegetable intake allowed. One thing that struck me from Mary Lou's talk was the food pyramid recommends, I think it was 2.5 to 4.23 servings of vegetables a day. We recommend 3 cups of vegetables a day. The vegetable content on a keto diet is not really different from what's recommended by the government, for what that's worth. Processed foods ought to be reduced on a low-carb diet. You don't have to be perfect, of course, but generally speaking, a lot of the bad stuff we're getting is, it's not the fats. And this is sort of a complicated way of saying that in studies of low-carb versus low-fat diets, people drop out to the equivalent degree. They're not dropping out of the low-carb arm faster. So people can stick with these diets. And frankly, in my book, we don't even need graphs or studies to tell us this because we have the patients that come back to show it. So this isn't a fad diet. This is evolution, and it's the way we should be eating. So you know, if you come away with nothing else, you know, the theme of sort of my approach is, it's got to make sense. And to say that a way of eating that our species evolved eating, that we can measure all kinds of risk factors improving on, with no evidence that it actually is harmful, no evidence that is worth believing, why would we be worried? So I'll stop there.